Pope Francis will pass, or depending on the moment you watched this video he has already undergone surgery. I decided to comment on it due to the relevance and repercussion that it is having at that moment, even without the great elaboration that we usually have here in the videos of Canal. My name is Daniel Coriolano, I'm a doctor, and let's talk a little to explain the medical part of this procedure. So Pope Francis has had some health problems in recent months or years. He even underwent surgery on his belly and abdominal surgery. He has been at times with the help of a wheelchair or even a cane. He is already 86 years old if I'm not mistaken, and some conditions related to aging have been presented to him. Specifically, this surgery he is going to undergo now, it's called a laparoscopy, or therefore autonomy. He's going to have the right abdomen for a correction of a very common medical condition in many people called hernia. There are several types of hernia, and specifically therein the case of Pope Francisco, it is an abdominal hernia. The hernia is a condition in which a part of the intestine, in his case, it keeps advancing the abdominal apparatus. So at our abdominal wall there is a layer of muscle. This layer of muscles prevents the organs from coming out. It is a support. However, as time passes, this muscle layer gets a little more fragile, weakened for several reasons. In particular, the occurrence of previous surgeries leaves the abdominal wall fragile. Women who have a greatly increased abdominal volume during the period of pregnancy, they also have a chance of having an abdominal hernia, and that was the case of the Pope Joao de Papa Francisco. He has had previous surgeries, and probably these previous surgeries allowed for a greater fragility of his abdominal wall, which led to a part of the intestine coming out from time to time. In some cases, just push the intestine again, returns to the place inside the abdominal cavity, which can happen in a situation of medical emergency, which is the impossibility of this intestinal content going back inside. And then at that moment he said that it is in a strangled R. So if that happens, it becomes a medical emergency and you have to have an emergency surgery, because the intestine begins to not receive enough blood flow from the body to the point of swelling and pain, and as the hours pass, a necrosis is that part of the intestine. It will become inactive and will cause a great harm to the individual in the case of Pope Francis. So in his case, according to the news published there, he has to have a scheduled surgery so that he does not run the risk of having a medical emergency situation. Here the hernia is strangled, and he had to have the surgery at the last minute. So everything was organized for him to have the surgery, and then in a surgery, it is called hernioplasty, they seek to give greater support to the abdominal wall so that the organs specifically there, the large intestine, do not come out. Leaving through this point of fragility, you can suture the muscle. Sometimes a plate is also placed to give a more layer of support, and there are several surgical techniques that are more specific in terms of the conduct that each patient uses and access to the equipment that each patient will have in different situations in Brazil, in other countries, depending on the specific technique situation of the individual. But in general terms, it is a medium complex surgery. Usually people perform the surgery, put the plates, correct everything, and stay in the hospital for a few days, right? So Pope Francis will be hospitalized for a few days until he regains his normal status. He also mentioned through his statement that he does not intend to resign like that because of his health condition. He even said something about what he is ahead by the brain and not by the knee, right? Making a mention that your physical condition does not imitate me, your cognitive capacity, your ability to think and make your own decisions. You give it to the church, while the Pope, he has been there for 10 years in the role and over 80 years old. So let's hope that everything turns out well. I hope I have clarified for those of you who are curious how to proceed in this regard, and maybe you too are, or have someone in your family with the hernia condition, and then you're done now, knowing more about this. I still haven't clarified everything. Do you have any doubts? Put them here in the comments area and I'll explain it to you in text format, or maybe I'll record another video on the subject. You will have access to other videos there. I always comment on health issues, whether of people with great repercussion here nationally or internationally, or even medical conditions, so that you can take your intelligence and health. So click on the button